Is needle chest decompression a temporary fix? Have you ever wondered how emergency responders handle life-threatening situations in high-risk jobs? One critical procedure they use is needle chest decompression. This technique is vital for treating tension pneumothorax, a condition where air builds up under pressure in the chest cavity. This pressure can compress the lung and other essential structures, making it a serious medical emergency. So, is needle chest decompression a temporary fix? Yes, it is. This procedure acts as an emergency intervention to stabilize patients suffering from tension pneumothorax. It is especially useful in pre-hospital settings, like trauma scenes or hazardous work environments such as logging, deep-sea fishing, or storm chasing. In these situations, immediate hospital care might not be available, making this procedure a lifesaver. When performed, needle chest decompression quickly reduces the dangerous pressure in the chest. This buys critical time for the patient to be transported to a medical facility for more comprehensive treatment. However, it is essential to understand that this procedure is not a long-term solution. After needle decompression, the definitive treatment usually involves placing a chest tube, also known as tube thoracostomy. This chest tube allows continuous drainage of air and helps the lung re-expand properly. Needle decompression alone does not provide ongoing drainage, which is necessary for long-term management. In high-risk professions, injuries like chest trauma can happen due to falls or equipment accidents. In these cases, needle decompression can be a lifesaver when performed promptly by trained emergency responders or paramedics. However, it is important to remember that this procedure is a bridge to more comprehensive care, not a final solution. There are limitations to needle decompression as well. It has a relatively high failure rate, often due to factors like chest wall thickness and needle length. Standard needle lengths may not always reach the pleural space effectively, especially in individuals with thicker chest walls. This can be common in physically demanding jobs. Using longer needles can improve success rates but also carries a slightly increased risk of injury to underlying structures. In summary, needle chest decompression is a critical, temporary emergency measure used in the field to relieving tension pneumothorax and reduce mortality risk. It stabilizes the patient until they can receive definitive chest tube placement and further hospital care. For those working in odd and high-risk jobs, awareness and training in this procedure can be vital, given the potential for traumatic chest injuries in unpredictable environments.